Hello. So, I have been posting this in different comments and videos of people discussing the Diane Schuler Taconic Parkway incident, my theory, and so I decided to make a video on my theory because I think it is something that, to me, sounds very familiar and might provide an explanation. So here goes. I have something called trigeminal neuralgia. Trigeminal neuralgia is when the nerve leaves your brain. There are three branches. One covers up here in your scalp and your eyeball. One comes down to your cheek, that's number 2, goes on your nose, and maybe in teeth, the teeth. And then the third is pain in the jaw area and these back teeth. And I have not so common type. I have 1 and 2. So it is comes in episodes of stabbing, lightning strike, piercing, incapacitating pain in the face or the scalp. It will take you to your knees. And it is nicknamed the suicide disease because so many people, well, before they got diagnosed properly, they didn't have a treatment yet, a lot of people commit suicide because the pain's that bad. There's another kind of pain that comes with it, and that is the constant burning pain. Now, what I get is a burning sensation on my cheek, and then a really hot sort of traveling line that by the end of the day, it has focused right here. And I feel better if I press right there, but as soon as I let go. And I consider that to be the worst pain because I know that when I get the sharp shooting pain, it's really painful in the moment and it's exhausting after the episode. But then it's over. The constant burning pain is something that is like all day, could be a few days. And a lot of times it's misdiagnosed. A lot of times, like in my case, because I was very young to be diagnosed with it, it usually doesn't show up until 40s or 50s. I was diagnosed in my mid-20s. But what is very, very typical, since most people have it in the third branch and in these teeth, is for people to go to the dentist because they think they have a toothache or their teeth hurt, and have a bunch of unnecessary dental work, crowns and root canals, which happened to me up here when it was at its worst. Now sometimes I just get kind of a vague sensation in these teeth sometimes. The cause that I know of, there's generally 3 causes. It could be a tumor pressing on the nerve. What is happening is the myelin sheath that covers the nerve gets worn away. And so it's just out there naked and raw, and starts to interpret things that are not painful as creating severe pain, triggering severe pain. So, let's see, so people are going to the dentist, getting this stuff done, and it's not working. And I was in the middle of a dental procedure, and they were trying to numb the tooth, and it would not yet numb. They tried squirting it right on the nerve and tried different numbing products. And finally, I was screaming bloody murder. I was in so much pain. This is before I was diagnosed. And so he finished up what he could, and then he said that I am not going to do any more work on you until I get this nerve thing situated. And so, you know, a lot of times it's a dentist that diagnoses it or suggests you see your doctor. I was gaslit when I went to my primary physician. They tried to tell me that it was because I had a history of depression that I was having these pains. But I was a nurse, so I kind of told him where to go and insisted on getting a referral for a neurologist. Anyway, long story short, causes. That's right. A tumor. A small little tumor rubbing on that nerve. It's rare. Also, people with MS, that MS is about the myelin sheath. Wearing away and pretty much all over the body. So when it's here, they get trigeminal neuralgia pain. And the most common cause at the time of my surgery, because now some people are saying it has to do with your neck. I don't think that was the case with me, because I did have surgery once I got to the right doctor, and they found 2 blood vessels wrapped around the nerve and put these inky dinky Teflon sponges between them, and said, and I had immediate relief. I woke up from surgery in recovery, and it was gone. And they told me I would have a good, usually 10 years. And what happens is gravity starts to pull the blood vessels down, and they start to droop and pull away. And then most people will have some more mild symptoms where it's controlled on lower doses of anti-seizure medications. I hope my dog is not keeping you from hearing this. So, and I had exactly 10 years. And then I started noticing symptoms again, but they were mild. And then 2 years after that, so a total of 12, I started taking low-dose anti-seizure medication to help control. I also use essential oils that will, if it's not too bad, will give me some relief for about an hour or two. And if that doesn't work, and I will take Tylenol. I can't take ibuprofen because I'm on lithium. But before I knew that, I did take ibuprofen. But that does help a little bit, because when you're in pain, your muscles are very tense, and you just get muscle aches just from being so tense because of the pain. And so those things help relieve that part of it. Especially, I get it, especially back here. And a lot of things for me, hair-wise, is a big trigger for me. Wind blowing in my hair just moving. I can't stay in a barrette very long, or a headband, because I have a lot of my problem is on my scalp. Okay, so what does this all have to do with Diane Schuler? I've listened to a lot of podcasts and watched the documentary, and when I heard them say that she had been to the dentist on several occasions, and then during one visit just stopped and left, made me listen a little more closely. And how excruciating the pain is of trigeminal neuralgia. People will do anything to avoid it or to make it stop. And I can easily see, because I have grabbed my head and fallen to my knees in public. Just a moment. Okay. So I can see somebody starting to get that pain, it's starting to get worse. Oh, and I must mention that if my essential oils don't work, I do use THC, either in the form of a gummy or chillum, little one-hitter, in the evening or bedtime, if it's really bad. And it's usually the burning, and when it gets to just that one point right there. It doesn't make the pain go away, but you have short periods where you forget it's there, and then you get another sneak peek of it, and then you forget, and it is kind of a weird sensation, but I like to do anything I can to make it stop. I've had to leave work on more than one occasion because of the pain, and because nobody sees that there is, like on your outer self, it's easy for people to think you're faking, to think that you're drug seeking. It's very frustrating. It's a little more well known in the medical community, like primary physicians and things like that. At the time I was going through it, I was running across doctors that said, "Oh, I've never heard of that, so I'm going to treat you for a sinus infection." So that was crazy. And So my surgery, I have a nice scar back here. So all this dental work, getting up and leaving, being a person that will not admit weakness or pain, maybe don't want, doesn't want to look like someone who needs anything from anyone. And it's possible that on these, she may have been to the dentist, she may have been to the doctor and gotten gaslit, because that's certainly what happened to me in the beginning. So you do what you have, what's available to get this pain to stop. I mean, you can't sleep, you can't eat, you can't shower, and she has all these kids to take care of, and so she has to be able to be on her game every day. What people who are looking for pain relief and don't have access to proper pain management, what are they going to go for? Because you have to relieve it in some way. There is no toughing it. It is excruciating. Look it up. It's one of the most painful conditions known to man. And so I can see her not getting this fixed through dentistry. It feels like toothaches, but it's not really. It's the nerve misfiring, and it travels to the lower jaw and the teeth. And people will have their teeth pulled and have root canals before they know what is really going on. So anyway, I can totally see someone in excruciating pain, trying to keep up appearances, get home on time, and this is common for anybody with pain. People have chronic pain. They're so affected by it that they do strange things. For example, when I was a nurse, I was on an oncology unit, and some people had pain. A lot of people had pain, and we would give them something more instant relief and probably an extended relief, and in those, like Percocet or Vicodin, we'd give them their 2 pills and explain, you're going to get the better relief if you take them both now, and then, when they're due again, take them. But they were so afraid of being in pain again, they'd break up their pills into bits and take one every hour or something like that. You just couldn't convince them. Pain does weird things. And to focus on driving home in an excruciating pain, someone's going to reach for something, anything, like alcohol and marijuana, which are the 2 most readily available things. And by this time she may have developed a tolerance, at least for the alcohol, and therefore thought she needed more, or drank some, smoked some, and it didn't help. And in desperation, grabbed for more. I can totally see that happening. When I watched the documentary, that's the first thing I thought of was, I bet she had trigeminal neuralgia. I think she was in pain, because it can be chronic as well as acute. You can have acute on top of chronic. You can be walking around with that burning on your face for days and also get the sharp stabbing, shooting pain on top of that. It's not pleasant. So that is my theory, and see, that's not something that they would, it used to be that the only way they were studying the blood vessel theory was when people had died, and and they looked and saw the blood vessels wrapped. So that's my theory. That's what I'm wondering, if that happened, because the whole situation to me makes me think of somebody in pain, desperate to get it to stop, and then finding themselves in a really bad state without intention. So that's my theory. I don't, because if it were a tumor, they would have seen that on, and she didn't have MS, they would have known that. So, but would they have looked to see if she had blood vessels wrapped around her nerves? And it can occur on both sides. It's rare. You don't really ever have it at the same time. It's just either or. I occasionally get pain right here on this side, but it's never been really an issue. So that is my theory. Please comment or ask questions if you'd like.